Hi, it's Patrick Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy, and where we also provide tailor-made solutions for hospitals and intensive care units whilst providing quality care and managing and saving resources, including the cost of an ICU bed by approximately 50%. We also provide home TPN for clients, as well as otherwise medically complex patients at home instead of in intensive care. Today's video, I want to quickly talk about a question we have from a reader, Claire. And Claire writes, my husband is 49 years of age and he had a liver transplant in mid-March 2022. He's currently still in ICU, and now we are at the end of July 2022. He has a tracheostomy and he's been on the ventilator since early April. Unfortunately, after multiple failed attempts of coming off the ventilator and the tracheostomy, his anxiety and fear of not being able to breathe inhibits any progress. His level of care, I believe, became questionable when he started retaining fluids in the lungs, and he's still in ICU after all this time. We are very frustrated because my husband has no quality of life in ICU, and we want to go home if we can. Can he be weaned off the ventilator at home? Why do you think he might have fluids on the lungs? And your insights would be much appreciated. So look, here's my take. If he can't be weaned off the ventilator, I'm not overly surprised. There is no quality of life in ICU, and after now 3-4 months in ICU, I think it's time for your husband to get back to some form of normality, which can be achieved at home. And there's often a huge psychological component when people can't be weaned off the ventilator. It sounds like he's tolerating the liver transplant well, and I'm sure they're medicating him well to manage that. But the main challenge at the moment seems to be that he's not coming off the ventilator. Now, if he's fluid overloaded on the lungs, one reason for that might simply be that they're giving him too many fluids and that he's not making enough urine. Maybe he needs to be started on a diuretic such as Lasix or furosemide. Maybe he needs some intermittent dialysis just to even out his fluid balance so that he's not fluid overloaded. Maybe he needs to go on a fluid restriction for a little while. But in terms of your husband going home, it sounds to me like that is the best option with intensive care at home, of course, to continue weaning him at home, right? Of course, there are other things that you haven't mentioned here. For example, is he on high levels of oxygen? But I would think, you would have mentioned that if that had been the case. And, he needs a team at home that can carry on with his progress at home and get him out of ICU. Another risk in these situations is simply that, especially for liver transplants, he might be immunocompromised now, and you don't want him in a hospital with several other sick people around where he's likely to catch an infection. And you certainly don't want that after a liver transplant, whereas at home he's in a much cleaner environment and the risk of infection is so much lower. So we can set up home care for him at intensivecareathome.com and provide you with 24-hour intensive care nursing that can be overseen by a doctor, and then continue weaning at home. So I hope that helps. You should reach out to us on one of the numbers on the top of our website. At your husband's young age, he should also qualify for some funding, especially if you are in Australia, but even in other countries with the NDIS. You should absolutely contact us on one of the numbers on top of our website at intensivecareathome.com, or simply send us an email to info@intensivecareathome.com. That's my quick tip for today. Also, check out our membership for families in intensive care at intensivecaresupport.org. We also provide medical record reviews for families and patients in intensive care. That's part of our service too. And if you like this video, share it with your friends and families, give it a thumbs up, subscribe to my YouTube channel for regular updates for families in intensive care and intensive care at home. Click the notification bell and comment below what you want to see next and what insights you have from this video. Thanks for watching. This is Patrick Hutzel from intensivecareathome.com, and I'll talk to you in a few days.